I have a message for Jeff Behm, CEO of Monarch, PEMSA, Hackensack, Robert Wood, every displaced employee from Monarch, and every EMT and paramedic in the state of New Jersey, and for Scot Phelps. Jeff, you mean to tell me that you and the board of directors went into a room and this is the best that you can this is the best that you can come up with? Your board of directors is Hackensack and Robert Wood. If you're one of the people that's affected by this, that got one of these notices, make no mistake about who did this to you as you scramble to go and get hired in these two places. Hackensack and Robert Wood did this to you. I'll get to them later. Jeff, you couldn't figure out a way to keep your people with health insurance? You haven't even told them if they're going to get their PTO. You told us you're going to get your PTO. You told us nothing. You blindsided us with something ironically called a WARN notice. We're all getting laid off April 1st. The company's staying around for 11 more months from now, till the end of December. You still have a job? You have a job, and Lori Corson doesn't. Does this make sense? How do you have a job? Is there one bad policy that got us to this point that you changed after you took over? What have you fixed? You care more about accreditation stickers and response. What good is an accreditation sticker on an ALS unit that takes 38 minutes to get there? I don't understand. We're still swimming in overstep. There's so many bad practices. How do you still have a job? I worked on 204 the other night. 204's coverage area is the size of Atlanta. And what do? You send me 35 minutes away to upper whatever, creamery, I don't even know, for a pronouncement, to point at a dead person, to bill Medicare $65. Is this financially good policy to you? It's certainly not good public health policy to take. I don't understand. What have you done? I asked you on the conference call, did you bother to obtain health insurance or benefit information from Hackensack or Robert Wood for these people? And you said no. I asked you why, and you said, we can always do better. Anna Ryan will tell you to do better. I'm telling you to do something. You've done nothing. You have no plan, no idea for how these people are going to go to orientation, how you're going to staff your trucks. There's no... Actually, you do have a plan. I'm sorry. Effective immediately. All days from this point until April 1st are considered key days. If you call in sick, you're not going to get paid. I looked at the policy. A key day can be added from time to time with reasonable notice to staff. Does effective immediately from this point on, every day is a key day, sound like a reasonable notice to staff? That doesn't sound reasonable to me. Guide your actions accordingly? Start guiding your actions accordingly. Are you kidding me? You can't call in sick. It's the middle of flu season. We work with sick people. If we're too sick for the truck, can we come and help you pack your office? I don't understand. You gotta be kidding me. Your people are panicking. They are scared. You've done nothing. Melissa McKenna and Tracy Cannella, they realize there's a crisis amongst their people. They're setting up career workshops, resume building, mega codes, mock interviews, scenarios, written test questions, proper dress code for interview, CISD. Your people are providing mental health counseling to each other. You failed. How do you still have a job and they don't? I don't understand. This is how you run this company. A week ago, 2 of your paramedics were on a call where a police officer shot himself in the head in front of them. Do you know what they were doing an hour later? They were running more calls. All these letters after your name, and no one taught you that that's not good for these people? You're going to pretend that you don't know that? Or is it just bad for your bottom line? Do something. You have done nothing. Do something. If you're worried, if you're worried that your legacy is going to be the guy that steered this ship into the iceberg, it's not. You're not getting off that easy. Your legacy is going to be the guy running around hiding the life preservers. Do something. PEMSA. Let me get my union pride going. What the fuck? What happened? I'm in the process of trying to start a union at Robert Wood. So new management came in. Robert Wood Johnson University Hospital disappeared from our trucks, and Robert Wood Johnson Health Network appeared on our trucks, and Mobile Health Services was born. We separated from the hospital. They had benefit fairs to show us how our benefits were changing since we're no longer hospital employees and we're employees of Mobile Health Service. So I filed a petition to start a union, and management said, well, you can't do that. We were kidding about Mobile Health Services. We're all New Brunswick hospital employees. I've spent a year. I'm supposed to go to court next week to prove that we're a separate entity. I have a wheelbarrow full of evidence. I have their tax returns. I have a paper they submitted to the state on a wage and hour dispute saying they're not covered by the Health and Hospitals Forced Overtime Law because Mobile Health Services is not a hospital. It's a unique entity. The Harvey Weinstein prosecutors have more of an uphill battle than I do. I have Tony Ruffino, the vice president, on videotape saying we're separate. We have our own tax ID number. We have our own Medicare billing number. If you look at the organizational chart of Barnabas Health, Mobile Health Services is separate from all the hospitals, yet equal. And I'm gonna win. But when I do, now I need to convince 800 people, more now, that union membership is the best thing for them, because it is. And my managers are fighting me tooth and nail because they know how powerful an effective union can be. I have to spend time convincing them that I'm not that. I'm not PEMSA. You think I'm going to charge people dues for that? I wouldn't want to pay dues for this. Make no mistake about any of this. This isn't just Monarch's failure. This is your failure. You spent more time with management discussing job shirts than our jobs. If you would have, from day one, stopped focusing on arguing with Vince about discipline points and started lobbying your legislators, creating taxing districts, fixing a revenue stream, something, you know the company's broke. Have you provided any solutions to fix it? Cancels. I don't know. We spend millions of dollars running around chasing cancels, 50, 60%. You think Monarch wants to do that? No. If someone calls, they have to send them. Maybe you could have worked with management. So, driving is the most dangerous thing we do. And we're not going to go to these calls and these. Work with them, make it a safety issue. I don't know, get the tree huggers involved, say we're polluting the planet. Something. There's things you could do. I've worked 2 shifts at Monarch since this was announced. And in my travels, I've spoken to people, and I've let them know, Monarch's closing, and invariably the reaction is pretty much the same. They say, what's Monarch? What? Do you know how impossible it is? For 4 decades, to drive around in orange and yellow, glow-in-the-dark billboards, and no one knows what the fuck you do? There's a playbook for this. Page 1, public support. Vince, we're gonna wrap 201 in pink for Breast Cancer Month, and you call the paper, you get a blurb, you let people know who you are, what you're doing. The same 55 plus community that you run 30 calls in a week. Did it ever occur to you maybe go to the homeowners association meeting, meet those people, take some blood pressures, fill out medicine cards, do something, get your name out there, be valuable to the public, create relationships with elected officials. If that was done, you could have made 10 phone calls to different elected officials in Monmouth and Ocean County, and this would have been done before the warn notice arrived in the mail. But you can't do that. You never fostered those relationships. You never cultivated them. You didn't put these people in office. They don't know who you are. What do you expect? I expect something. I'm gonna meet with Jeff next week and talk about Bennett. Next week? You're not organizing a T-ball fundraiser. Your people were fired. I'm on my way to Jeff. Going to talk to Jeff. That's your plan? I can tie half my brain behind my back and come up with a list of 100 things that you should be doing right now, and not one of them is waiting to talk to Jeff. Jeff has punched you in the face every chance he gets, and your plan is to wait to walk in there so he could hit you in the head with a baseball bat? Start here. I can follow the bouncing ball, so let me tell you how this is going to work out. When this fails, which it will, because everyone pretty much thinks it's going to... No one's looking at Robert Wood and Hackensack as coming in here that they're going to fix everything and make it better. The best we're hoping for is that they're just going to keep doing things the same messed up way that we've been doing them, and we don't even have faith in that. But when it fails, they're going to use this to shove one medic, one EMT down your throats so fast, and it will be your fault. It'll be your fault because when O'Scanlan puts out a bill, you don't talk about it on Facebook. You sit down with him, meet with him, figure out what his intentions are. Is he in the pocket of the hospitals, or does he realize there's a problem and he's just trying to fix it? And you let him know. It's a bad way. People are going to die. You bring him data. You show him we have 10 medics trucks for 2 million people. I mean, you do something. At this point, what do? Start with some data. Find out from these hospitals. How many paramedics are they going to hire? Ask them, are you keeping up every single one of these trucks? You ask Hackensack and you ask Robert Wood. And if they give you any answer other than yes, if it's a no, or we don't know, or we're evaluating, then you take out a full-page ad in the Star Ledger and the Asbury Park Press, and you let these residents know Hackensack will not commit to keeping this medic truck up. You do things. Did you hire a forensic accountant to study Monarch? Did you file an injunction? Did you sue them for the sake of suing them and you'll figure it out later? You did nothing. My union president is asking me on a Monarch paramedic Facebook group if someone can confirm the benefit information for Robert Wood Johnson. On a Monarch paramedic Facebook group. On a Facebook group run by Andrew Rivera because you took away our Facebook page because you didn't want us to talk to each other. You're charging these people dues for this? Are you kidding me? What do you do now? I don't know. You remind your people, first and foremost, that Hackensack and Robert Wood did this to them, and they didn't have to do it like this. You can implement a buddy system. I'm not taking your job unless you hire my partner. You tell everyone to slow down. You think they're panicking now to get this done in 60 days? Not one person should file an application for the next 30 or 45. And if you have, and I'm applying at both, then guess what? When they offer you the job, you let them know you'll think about it. I guarantee you the offers will get a lot better in the meantime. This whole plan only works with us. They need the people. I would have walked into Jeff's office today with a letter signed by at least 70% of my employees saying that if we don't get every single bit of PTO and sick time that we have on the books, we're not accepting another job. And guess what? You'd have it. Sit down with these hospitals. Scott Phelps, you and I, we got into it a little bit the other day. You commented on a Facebook post, a job posting that Robert Wood put out. And you said that it's your belief that you submit that dispatchers should make more than EMTs and paramedics. And I had commented that people are looking to you for guidance and you have to know that. And that was the best that you can. And I'm not saying that dispatching is not important. I'm just saying that, 1 in 5 paramedics in your state just lost their jobs. I'm not sure what I wanted you to say, but I would have been less offended if you posted a recipe. Um, I don't know what I wanted you to say, but it certainly wasn't that. And you sent me a text and you said, not sure what you want me to say. Monarch ceasing operations. Hackensack and Robert Wood are taking over. I know, I got my warn notice. There's a lot of details that still need to be worked out. I met with Monarch, Hackensack, and Robert Wood on Thursday, and there's another meeting next week, but I only know a little more than that. There's a meeting? I'd like to go to that meeting. Tracy Cannellan would like to go to that meeting. I know 319 other people that would like to go to that meeting. Because if you think for 1 second that the people in these meetings have we know they don't care about the road staff, but if you think that they have public safety and public health as their motivating factors, look, what do you think happens if you have a stroke or a heart attack or get hit by a car and they take you to community hospital in Toms River? We pick you up and we drive past the hospital that can handle all those things because it's labeled differently, and we drive 40 more minutes to our hospital. This isn't about public health. You have to know that. Both have large and complex mobile healthcare organizations, and I'm confident that there won't be any major operational problems. That's adorable. That's your plan? Faith? Your plan is that you're confident because they're large and complex organizations. There's not going to be operational problems. I work for one of these organizations. There's operational problems. We run out of radios. The other day, I was on the East Brunswick truck, Robert Wood's East Brunswick truck. I got sent from Manalapan to Highland Park. Does this make sense to you people? Let me put it in other terms. The Robert Wood East Brunswick truck was in Monarch's Central-State area, and I got sent to a call that was so far away, I had to pass a Hackensack and a Barnabas hospital to get there. Does that make sense to you people? There's operational problems. I drove around in a truck with the wrong size tire on it for 16 days. What's your what do I want you to say? I want you to recognize, as Steve Velasquez says, that there's not an EMS system in New Jersey. There's an EMS situation in New Jersey. System involves integral parts that work together. This is not a system. Your biggest agency crumbled. This is a chance to fix some of this stuff. You're meeting with the people that broke this and expecting them to fix it. Put Skip Kirkwood in the room. Put Corey Van Enslen in the room. I've never met these people, but I trust that they have my best interest and the public's best interest way more than the people who I know that are in the room. You're making it like this isn't your problem. What? And I know I'm getting fired for all this, and now I'm going to get audited. But what does your office do? And with no sarcasm, all I can tell is we have bad protocols that are legislated into law. There's no other area of medicine where treatment modalities, medicine evolves. So you lock us into bad protocols. What else do you do? You make the process of obtaining a T number card in this state almost as difficult as getting a concealed carry permit. And you put out Narcan training for us, which we get it with the Narcan training. We're good with the Narcan. What I want you to do is ask these places, what is your plan? Because I'm assuming, knowing some of the personalities involved, that they're coming into these meetings and they're pretending that they got this all figured out because they're the biggest, baddest, and they got a set of balls that clink. Well, let me tell you something. I have friends on management teams from both these places. They don't have a clue. And if you're one of these people listening, that's okay. We're in uncharted territory here. It's okay you're in these meetings. If these are your 10 best people in these meetings, let us put our 10 best people in these meetings. Let us figure this out together. If this isn't on you, who's it on? Hackensack Meridian Health and Robert Wood Johnson Barnabas Health. You guys should be ashamed of yourselves. You're coming in here like you're the rescuers, like you're going to fix this problem that you created. I was at shift change the other day, and I relieved Sue Lowe. She was stressing out about resumes and cover letters. Sue Lowe. This woman is the salt of the earth. She's worked for this company for 32 years, and not 1 minute of it has been spent unprofessionally, uncaring, in any way that would give any employer pause. She has a calming demeanor. She's a professional. And if one of my kids needed a paramedic and she walked through that door, I would be relieved to see her. That is your resume. Dave Dwight will, not only does he know the best pizza places in the area, he knows the name of the guy behind the counter. And you know what? Lori and Cindy come as a pair, and that's all right. And you should let them, not because they can't do it on their own, but because when they're together, everyone around them is better for it. And this is stuff that you're not going to learn from a cover letter. Dear applicant, thank you very much for your application to Hackensack University Medical Center. We're sorry to inform you don't meet the qualifications. We wish you the best. Someone's going to kill themselves over this shit. And when they do, I'm not blaming decreased Medicare reimbursements. I'm blaming you people. You're making these people take megacodes? Megacodes. You offer jobs to paramedic students. You offer jobs to unproven people. These people are proven. You're going to fail someone because they said milligrams instead of milli equivalents. It hasn't occurred to you guys that in all the man hours you're going to spend interviewing and megacoding these people would be better spent saying, you know what, we're gonna assume your clinical competence, and we'll spend that time training you to our system, getting you acclimated. But even that, you're looking at this like you're coming in and your way is better. These people, they know the area. They know the BLS. They know the cops. They know when you go to that address for the seizure call, you better bring 15 cops because that guy's going to beat the shit out of you. This is what you lose. You're losing this. We can learn from these people. There's enough holes in the schedule, and this is what no one talks about. Robert Wood, we can't staff our trucks. Hackensack, you can't staff your trucks. Monarch can't staff their trucks. Simple math. You could have kept every single person in their seat, and your people could have filtered down into these open vacancies and learned from the Monarch people. You're having job fairs? Like you're opening an Amazon warehouse? These people are professionals with skills that you need. You don't have people lined up for these jobs. You have 320 orphaned children, and you two are acting like you're making them choose which shitty foster house to live in. Act like you want to be their forever family. They'll come to you. What do you think is going to happen when they get together at their resume building workshops and they start talking and they realize that you did this to them? Do you think that they're not going to fight back at some point? Yeah, they're scared. They're scared. They're flipping it and they're filling out these applications. They're going to realize, here's your mega. That's a distracting injury. They're not mortally wounded. It's a distracting injury. The way that you conduct yourselves is, Robert Wood, you guys you're trying to get hired here. I've been arguing with Robert Wood for 4 years about disciplining employees for taking sick time, which is much better than the old policy of if your wife had a heart attack or your kid broke their arm and you had to leave, they would just dock your pay. So yeah, we've come a long way. Now there's laws that protect. Policy subcommittee meeting the other day. This is Robert Wood's new attendance policy. This is the new one, approved by Jim Smith. Everything in orange is a reference to discipline. We asked HR, how can you discipline people for taking sick time? Still, and they go, well, we need to cut down on sick time abuse. Do you know what's not mentioned once in here? Sick time abuse. This is the places that you guys are trying to get hired at. An EMT at Robert Wood told me last month, they got a swap, their grandfather died and they got a swap. And I said, why didn't you take bereavement leave? And I said, well, I don't want to like cause any trouble or get, that's the culture. That's where you're trying to get hired. That's the culture at Robert Wood Johnson under this management team. I don't want to take funeral leave because I don't want it to look bad. And Hackensack, you are no better. The circus is different and the clowns are the same. People need to realize you need the employees. The employees don't need you. You know what? If no one comes to work for you, then you need to go back to your bosses and say this failed. Start treating these people with the respect that they deserve. They're professionals. They're worried about putting food on the table, and you haven't worried about mega codes? Are you kidding me? If you want to show any sense of respect for their profession, any sense of desire to have them come work for you, let's start here. By the end of the week, between the two of you, put out a joint statement or separate statement if you can't talk to each other. I don't know. Let us know. How many people do you plan on hiring? Because there's one of two reasons that you're not going to tell us that. Either you don't want to tell us, which is a problem, or you don't know. You knew this was coming for a year. If you don't know how many people you're hiring, then you shouldn't have jobs either. But can we start there? Can you let these people know if there's a reason to panic, and if so, how panicked they need to be? Fix this. You're doing this wrong. Fix it. Do something.